Over the last 2 decades, the US has been the largest bilateral donor to the fight against malaria, helping to prevent an estimated 2.2 billion cases and 12.7 million doses. If disruptions continue, we could see an additional 15 million cases of malaria and 107,000 deaths this year alone, reversing 15 years of progress. It's a similar story with HIV. The suspension of most funding to PEPFAR caused an immediate stop to services for HIV treatment, testing, and prevention in more than 50 countries. Disruptions to HIV programs could undo 20 years of progress, leading to more than 10 million additional cases of HIV and 3 million HIV-related deaths, more than triple the number of deaths last year. On tuberculosis, 27 countries in Africa and Asia are facing crippling breakdowns in their response, with shortages of human resources, disruptions to diagnosis and treatment, data and surveillance systems collapsing, and vital community engagement work deteriorating. On immunization, WHO's global measles and rubella network of more than 700 laboratories, which was funded solely by the US, faces imminent shutdown. This comes at the worst possible time when measles is making a comeback. The sudden cuts to US funding are also affecting efforts to eradicate polio, to monitor the emergence of diseases such as avian influenza, and to respond to disease outbreaks and humanitarian crises. Almost 24 million people living in such crises are at risk of not being able to access essential health services. The US administration has been extremely generous over many years. And of course, it's within its rights to decide what it supports and to what extent. But the US also has a responsibility to ensure that if it withdraws direct funding for countries, it's done in an orderly and humane way that allows them to find alternative sources of funding. We ask the US to reconsider its support for global health, which not only saves lives around the world, it also makes the US safer by preventing outbreaks from spreading internationally.